I am a third generation of doctors, and my grandfather was a surgeon, my grandmother as well. They met during the Second World War and were surgeons on the front lines. And then my father is a surgeon. When I came here, I had a pleasure of working with, great surgeons, and I fell in love with the specialty because it just provides such a great variety of different procedures, from something very small to something very big and complex, and also a great variety of patients. First, we try to establish the relationship pretty early so that it's not a shock for the patient, and sort of they can do their own research. And usually it's an informative visit where I get to learn what their life is like, what they want to accomplish in future, and how they want, to live, and what they need to do in life. And we take it from there. So it's really not a true gold standard in terms of just this procedure for everyone. It's a very individualized approach. We work very closely with gastroenterology colleagues so that patients can establish care in case they needed a surgical intervention at a certain point. But at the same time, the beauty of colorectal surgery is that it's not only about performing a resection and then your relationship with the patient is over, because we really establish a lifelong relationship with them from sometimes very young age and forever when they need checkups. And that's what I specifically enjoy, because you really get to learn their life and their expectations. Being a part of somebody's life in this and taking a part to save somebody's life, because we deal with young patients who can get really ill, and when you get to see them get their life back, it's a true reward. When you get to see them, get their quality of life back. And I always tell them, we'll be in contact with you for a long time, and even afterwards, even after I do your reconstructive surgery. I just keep my door always open, and my chart and Epic for patients, and I always tell them to reach out with absolutely any question, and I just want to be able to help with whatever I can.